Thank you, everybody. Thanks for coming out, and thanks for the invitation. It's always nice to get out of the valley and get up here where it's green and scenic. So I've got 10 minutes to cover everything you need to know about cattle health, so that's a tall chore. But we'll, I guess the things that I need to emphasize, that early detection is key. The earlier you see it, the easier it is to treat. Those eyes that Dr. Angelo showed you, if you catch those early and give them some antibiotics, chances are they're going to get better. And so you know all the signs that you need to look for: droopy ears, low head carriage, dull, rough hair coat, things that you're going to recognize a lot earlier than probably your veterinarian will. So you know your animals better, you know what their normal is, so that you can easily recognize what's abnormal in those animals. So the good news is most cattle don't get sick. These are some national data from 1996. This is the most recent National Animal Health Monitoring System study of beef cattle that's been done. And we see that in calves, scours diarrhea is number one. See some respiratory disease and some pink eye and foot rot in older calves. And similarly in cows, we see those same diseases: respiratory disease, scours diarrhea, pink eye, foot rot. And then things like retained placenta, abortion, and those sorts of things we also notice in cattle, in adults. So these are the main things that you'll be seeing. So I kind of broke this down into categorizing what your complaint might be. So the first thing I thought I'd talk about is, gee doc, I've got a cow that's lame, or I've got a bull that's lame on one foot. There's a variety of things that you need to think about when you hear those words. And it's not all pink eye. We'll talk about that out the chute later as well. But you immediately think of, I said pink eye, didn't I? It's not all foot rot. We'll talk about that later at the chute. Foot rot is very common. You've all seen cases like that. It's a bacterial infection of the tissue between the claws. They get painful. There's a lot of discharge. They stink. The cows go off feed. And that can be really bad. It can spread up the leg to the rest of the foot and make them very lame. Management of these animals is fairly straightforward if you catch them early. Again, early diagnosis and treatment is key. So you get that sick animal, get that lame animal out of there, because again, just like that pink eye calf with all those bacteria, this foot rot animal's got a ton of bacteria that are ready to spread to any other animal that might be susceptible. Treat with appropriate antibiotics. Again, tetracycline is one that's commonly used. It's licensed for treating foot rot. But discuss with your veterinarian what might work best in your situation. Unsanitary conditions are a primary risk factor for this disease. So muddy corrals and so on are things that we commonly see. Organic iodine can be used to help prevent foot rot. And there are vaccines that are available that do help reduce some of the incidence of foot rot. So you've seen these pictures before. In between the claws, raw area, lots of discharge. They stink, and they can extend up the foot and make that animal very lame. You need to differentiate that from something like corns, interdigital hyperplasia. This is not a truly infectious disease, but it's hard tumor-like mass between the toes. You can give these cows or bulls all the penicillin you want. It won't touch those. These need to be removed surgically, and then we bandage the toes together or wire them together or something like that. A number of other things can make a cow lame, make a bull lame: sand cracks, ulcers, foreign bodies, nails, a number of things. So I guess the message is, don't just assume that every lame cow has foot rot. You need to check them out, lift the foot so much the better, and just make sure you know what you're dealing with. What I really want to stress here is that a lame bull is big problems. You need to deal with those in a hurry. They won't be breeding cows. They'll be laying around, and they just won't be mountain cows. Also, any cause of a fever in a bull can interfere with spermatogenesis, and that's going to have an effect for a long period of time. So even though that bull might be better, might be walking good, he still could be shooting blanks, because that sperm cycle takes 60 days from when the damage occurs until he's producing nice healthy sperm again. And so keep that in mind. If you're treating a single bull out with a group of cows, you might want to consider getting a backup for them. So another common thing that we see, calf with scours, a number of different potential causes, bacteria, viruses, protozoa. The main thing is that these are infected from contaminated environments. So you get it from another calf, they get it from a cow that's shedding the organism. The calf can serve as a biological amplifier, so a sick calf makes more of these bugs and contaminates that environment. So the signs we see, obviously diarrhea, but we'll also see rapid breathing, they'll be weak. They may or may not have a fever, depends when you catch them. If they're really sick and been sick for a while, you'll catch them at the other end, their temperature will be below normal. The main thing that we do for these is correct the dehydration with electrolytes. Again, a key thing with all of these diseases is trying to prevent them. So the key to preventing scours is 2 basic levels. Increase the level of immunity in the newborn calf. So we need good colostrum. As Dr. Moss mentioned, you need to feed those cows right in order to get that good colostrum so that calf will be less susceptible to getting sick. There are vaccines against specific pathogens, and so you can vaccinate the cows. But again, that doesn't mean a thing if the calf isn't consuming that colostrum. So you have to make sure that calf is up and walking and bonding with the cow in order to make sure that they get colostrum. And then the primary thing is to reduce exposure to infectious organisms. And you can do that through calving pasture management. I've got a couple of different systems here. This is pretty common. You have a gestation pasture where all the cows are out getting ready to calve. Then 1 to 2 weeks prior to calving, you move them all into a calving pasture. Then as they calve, you put out pairs into these nursery fields. And keep the age difference between the youngest and oldest in these nursery fields less than 30 days. And this works quite well. The trouble here is you're moving cows and calves into the nursery fields, and sometimes that can be a bit of a challenge. So a few years ago, this Sandhills calving system was described. And it's, again, the same idea. You're moving the cows away from infectious organisms. So here, you put all the cows into this pasture 1 for the first 2 weeks of calving season. Whatever doesn't calve in that first 2 weeks, you move into pasture 2. So what's left here are cow-calf pairs that are within 2 weeks of age of one another. And then after another week, you move the cows that have not calved into pasture 3. And then the cows that have not calved into pasture 4, and so on. So this requires a series of calving pastures. And the good thing about this is you're moving cows that have not calved into these ongoing pastures. And that's generally easier than trying to move pairs. Ill threat, chronic diarrhea. Again, it's going to depend a lot on whether it's an individual cow that you're dealing with or if this is a herd problem. If you have an individual cow, you'll be thinking more along the lines things like Johne's disease, BVD virus, mucosal disease. If you have more a herd issue, you're going to have to consider Coccidiosis Parasitism. Again, mineral deficiencies are pretty common. And don't forget good old agrosriosis. That's a pretty common thing that causes thin cows. Another common thing we have questions about are cows or calves with snotty noses, open mouth breathing, that sort of thing. And again, don't assume that everything that has a snotty nose has an infection that needs treatment. Some of these cows will just have a sinusitis. Hot, windy days, you know that. You know what it looks like, a nasal discharge, clear nasal discharge, caused by dust, pollen, and mold, and that sort of thing. And those don't require treatment if there's no fever. So that's where the importance of a good working thermometer becomes critical. Pneumonia, of course, is the next stage that you might consider in this description. These are generally contagious diseases. Again, a number of viruses and bacteria can be involved. Once again, the key is catching them early. Once they get to this level of fibrinous necrotic pneumonia, it's pretty hard to get a good response to whatever you're using to treat those with. Again, we want to isolate those, use the appropriate antibiotics, ancillary therapy, things like Banamine, that sort of thing are sometimes used. Prevention, again, We do have vaccinations available. There's probably over 50 different vaccines that you can get for various respiratory components. These should be viewed as more disease modifiers. They're not going to completely prevent disease. The importance of minimizing stress and adequate nutrition and minerals can't be overemphasized in pneumonia prevention as well. Common thing to see out on pasture is that cow with a swollen head, swollen face. A number of things to consider there. Wooden tongue is a pretty common bacterial disease. I'm sure you've seen those or felt them. The tongue is just hard as a rock. Lumpy jaw is another one, another bacteria. We can treat those fairly effectively with sodium iodide intravenously. Depends again how far gone those are before we see them. Abscesses, things like foreign bodies and foxtails. Another thing to consider is a condition called bottle jaw. Through malnutrition or parasites or heart failure, you can get edema swelling under the jaw. And again, many of those things won't respond to whatever antibiotics you want to try and throw at them. So differentiating between these can be somewhat difficult. But if you run them in the chute and take a good look at them, that's at least the place to start. And then you can provide the vet with more information if you go that route. Cattle with runny and cloudy eyes. Dr. Angelos did a wonderful job on pink eye, but keep in mind that other things can cause runny and cloudy eyes. IBR virus is one of them. Cancer eye is another one. So here's a very early cancer eye. It doesn't show up very well, but just a small white dot right on the cornea. We can see this in the eyelid. We can see it in the third eyelid. The important thing about these is deal with them. Either get rid of that cow, get it removed surgically. Don't leave those hanging around until it's big and ugly and rotten and stinking and a mess. That's a real bad thing for the cattle industry. It's an important animal welfare issue. And so I can't emphasize enough to just deal with it. Whatever you do, make sure it gets taken care of. Sudden death, these are harder. You go out and you find a dead cow. Well, what caused it? That can be really hard to differentiate, especially if it's 95 degrees and the cow's been out there for 2 days. You just got a big pile of mush by then. These clostridial diseases are pretty common. Blackleg, malignant edema, red water, those sorts of things. Anaplasma is common in these foothill areas. Anthrax, hopefully it's not anthrax. That's a reportable disease to the feds, or to the state at least. And so there's a whole long list of possible causes of sudden death. And I'd be remiss to try and say that I can differentiate them over the phone. And so the important thing is to get a diagnosis on those and go ahead and deal with whatever it is that the specific cause is. Just to emphasize some of the beef quality assurance things. This is in your handout as well. Follow all the guidelines, FDA, USDA, EPA. FDA regulates drugs, USDA regulates biologicals, EPA regulates insecticides, and so please follow the guidelines. Use the products as per label in directions. We can use drugs off-label if you have a valid veterinary client-patient relationship and get a prescription from your vet. Try and minimize that. A lot of the drugs that we have are good. There's good label uses, good label indications. So don't be just pulling something off the shelf and using it irrespective of what the label says. Please adhere to withdrawal times, maintain treatment records and that sort of thing, and that can help minimize any potential for safety violations. So please pay attention to that sort of thing. And that's all I've got for you today. We'll be out at the chute talking about some of these things later on after lunch as well. And I'll be around for questions too.